As the founding director of MediAngels, Dr. Singal manages medical operations, human resources, treatment algorithms, business tie-ups and company policies at MediAngels. Dr. Singal is a renowned Mumbai-based pediatric urologist with over 17 years of experience in healthcare. Having trained from topmost medical institute of India, AIIM's New Delhi, Dr. Singal has also been a visiting faculty at Harvard Medical School and Boston Children's Hospital and University of Minnesota, USA. In addition to his clinical expertise in laparoscopic surgery and endourological surgeries in children, Dr. Singal is also a reviewer for medical journals and has more than 30 scientific papers to his credit. He has contributed chapters to World Textbook of Pediatric Urology and Textbook of Pediatric Surgery and has been invited speaker at the World Congress of Pediatric Urology, American Urological Association, British Association of Pediatric Surgeons and many national courses. Dr. Singal has been bestowed with several awards and accolades, including Gold Medal in MBBS, Gold Medal at AIIM's, Stecker Scholarship at Ohio State University, and UC Chakrabarti Award for the best research paper for his urology research work at Annual Meeting of Pediatric Surgeons. Dr. Singal feels strongly about children born with abnormal reproductive organs and has started a Hyposadias Foundation to financially and medically help such children. He also has a patent for a Hypospadias catheter to his name. Apart from medical and corporate roles in his free time, Dr. Singal likes to write and travel. His articles have found mention in Times of India and DNA newspaper. In this video, Dr. Arbinder Singal tells you about common urological problems in children.
My practice is mainly pediatric urology, which is dealing with children who have surgical problems of kidney, urinary system and reproductive system. So the common problems which I see are hypospadias, undescended testes, children with urinary infections, children with tight foreskin, children with kidney swellings, kidney stones and bedwetting. Urinary infections are very common in children, especially in the newborn age and in male children. But after the age of 1 year, they become more frequent in girls, especially because girls have a tendency of holding on to passing urine during the schooling hours. Sometimes girls don't go to toilet for almost 5-6 hours. Resultantly, this puts a huge amount of pressure on the bladder and later on they have wetting problems and infections. The way to prevent urinary infections in children is to make sure that they go to toilet very frequently, take enough amount of liquids and keep their reproductive organs clean. In children, sometimes in male children, there can be a tight foreskin which can lead to repeated infections. In girls, it can be improper hygiene of the vaginal area which can lead to infections. So all these factors need to be taken care of. Most of the pregnancies are planned these days. They're working parents and everybody tends to have just 1 or 2 kids. So all the pregnancies are very precious. And when the parents learn that their developing baby has a kidney swelling, it can be a period of great trauma. And they go from place to place trying to find a person who will give them the exact knowledge. Some of them turn to Google, but the other ones just rely on their family physicians. In the present day era, the family physician or the gynecologist, they may not be trained enough to give the full and fair information to these parents. So it is very, very important that we educate the pediatricians, the gynecologists, everyone about these new set of disorders so that they can give information to the parents. Parents often go through a lot of despair, they go through a lot of shock, ultimately denial, and they try to blame themselves or each other for this condition. The important fact is that this condition is not hereditary. It doesn't come from one parent to the kid. So it's very important that they are told about this fact and they can look at the whole problem positively, get the full information and then put the child on the right track for treatment. The results of treatment and surgery are excellent in most of these children. So there is no need for abortion. There is no need for getting any major kind of testing before the child is born. Some of these children may require extensive testing after birth, but 60 to 70% would not need any testing.